How do tumor markers relate to RPLND in testicular cancer? Imagine you're facing testicular cancer treatment and wondering how doctors decide whether surgery is needed. One key piece of the puzzle is tumor markers, which are substances found in the blood that can indicate the presence of cancer. These markers help guide decisions about a procedure called retroperitoneal lymph node dissection, or RPLND. In testicular cancer, the main tumor markers are alpha-fetoprotein, human chorionic gonadotropin, and lactate dehydrogenase. If these levels are high before treatment, it often means active cancer is present or that there is residual disease after chemotherapy. After treatment, if the markers return to normal, it suggests that the cancer burden has decreased or that remaining tissue is dead scar tissue or fibrosis. However, normal markers do not always mean there is no cancer, especially if a residual mass remains. When planning RPLND, doctors look at tumor markers closely. If markers are elevated before surgery, it indicates there might still be valuable cancer in the lymph nodes, so removing them through RPLND can be beneficial. Even if markers are normal after chemotherapy, surgery might still be recommended because some residual masses can contain teratoma or live cancer cells that do not produce markers. Researchers are also exploring new markers like microRNA miR371, a 3P, which could improve the ability to predict whether residual masses contain active cancer. These emerging markers are promising but are still under study and not yet standard practice. In clinical practice, tumor markers are combined with imaging scans and physical exams to decide the best course of action. For example, in patients with small lymph node metastases who want to avoid chemotherapy or radiation, RPLND might be an option, especially if tumor markers suggest active disease. Overall, tumor markers are vital tools that help doctors determine if surgery like RPLND is needed, how urgent it is, and whether residual masses are likely to contain cancer. They do not tell the whole story alone, but when used alongside other tests, they help create a clearer picture of the disease. Remember, each patient is unique, so always discuss your specific situation with your healthcare team. Following current guidelines and scientific evidence ensures the safest and most effective treatment plan.